Hemangiomas are a unique biologic tumor of infancy. During the first few weeks of life, some children develop a red scratch or a red mark. Some of these marks develop into larger lesions, and these are called hemangiomas.
We came to Dr. Levitin because my son had a large tennis-sized ball birthmark behind his ear, and that came about 2 weeks after he was born, and we just weren't comfortable waiting.
We first came to Dr. Levitin when we noticed Maximus's nose was growing rapidly at around 6 weeks old. We did some research online and discovered that Dr. Levitin was the best in the field.
First seeing that my son had a birthmark and not knowing what it was, and certainly not knowing the extent that it was going to grow to, it was very scary. There's really not a whole lot of information on the internet, and then the things that you do read about are like terrifying.
Initially, I was trained as a head and neck surgeon for cancer reconstruction, and about 12 years ago, one of my twin daughters developed a hemangioma on her lip, and this hemangioma happened to grow very quickly and very fast, and it was very difficult to find a specialist to treat her. After going through her treatment, which included medical, laser, and ultimately surgery, it changed the focus of my practice, and now that's what I do.
To be a first-time parent and to know that your son may potentially need surgery one day is so scary. And if I didn't meet Dr. Levitin and work with him, I don't think I could have done it.
I like to think that my practice is unique in the way that I approach the patient. I find that most parents come here and need information. Information is empowering. It helps them understand the process. For many of these parents who are often the first-time parents who have a newborn, it can be very stressful. It can be very confusing. Based upon a single visit, I can often provide an accurate diagnosis and even provide initial treatment options that make parents feel that they're taking charge of a situation that perhaps they had felt a lack of control.
I just want the best for my child, and I want him to have the best treatment possible, and to make my son better is such a blessing.
Being able to find Dr. Levitin changed our life. I know it's changed my son's life for the better. Now he doesn't have to deal with those things. He's a normal 1-year-old.